Voice of Armenians TV New York recently had an opportunity to visit the office of our compatriot Dr. Alina Stanciu and learn about her work in eye care as well as cosmetic and aesthetic improvements, including Botox, Juvéderm, Radiesse, Restylane, Latisse, and wrinkle reduction. Dr. Stanciu is a board-certified ophthalmologist with over 18 years' experience in specialized medical and surgical eye care. Dr. Stanciu is both widely recognized and highly regarded for her ability to provide expert medical and surgical care, combining advanced medical specialization with warmth and sincere human empathy. In the first part of this two-part segment, Dr. Stanciu will focus a technique she has personally developed called European Fluid Facelift.
I want to welcome you into my office and my practice and talk to you about the European Fluid Facelift. What is the European Fluid Facelift? The European Fluid Facelift is a procedure I developed as an alternative to traditional surgery because over the years I found more and more women and men that they want to have a procedure that they could look younger and natural without using surgery. This procedure, it's a quick procedure compared to surgical approach. The results are immediate, relatively painless or very little pain, there's very little bruising. People could go on with their activities after this procedure with very few limitations. I advise my patients to avoid going to a dentist for about 3 weeks after a procedure or that involves the lower face or the lip enhancement. But in general, people should not cancel any daily routine activities or social plans or events if they have a procedure like this. The procedure is less expensive than compared to traditional surgery. I put my patients in a plan of maintenance because everybody asks me, how long does this procedure last? It lasts forever as long as you're maintaining a protocol where you do 2 or 3 enhancements per year depending on the age or the situation of each patient individualized, and addresses people of ages from 20 to their 60s or 70s. Any gender could benefit from it, like men and women. The only contraindication is that I don't recommend for women that are pregnant or women that are breastfeeding. I usually try to rule out any patients that have other medical conditions that cause excessive bleeding or a risk of clots. So I do a pretty thorough screening before I recommend the procedure to my patients. How I developed it, I realized that this time we're getting more and more products, like you could see here, that are available to create this alternative approach. The products are several, and I will only mention a few. The newest is Velour. This is used for nasolabial folds. It's also used for deeper wrinkles on the face. And it lasts up to 18 months. It's the newest hyaluronic. Voluma, it's used for mid-face lift. It's also a long-lasting product. I recommend that for in combination or sometimes by itself for the mid-face lift. Sometimes I combine that with Radiesse. It's not a hyaluronic. It's a hydroxyapatite product, and it's very good in mid-face lifting, very efficient. In combination with Voluma, I had very good results. For the lips, I recommend Volbella, Juvéderm, or Velour. All these products could be combined in different proportions and in different ways in order to achieve the need of each patient. Why is my approach different than others? Because I address the entire face. I customize this procedure to every individual need, and that is done with an original and initial consultation. I take time to understand my patient concern and address the signs of aging with a program that makes them look younger and natural. I also pay a lot of attention to skincare, and I always educate my patients about how important it is to go in a skincare program that will maintain the results of this injectable products with the need for maintaining good hydration, moisture, elasticity, and nourishment of the skin. And with that in mind, I developed a product that's called Bella Plmd. This is my face and eye cream that I developed, a line of anti-aging products. This cream it's made out of organic essential oils. It has very high-end hyaluronic. It penetrates very well. When you use it, it creates this nice natural elasticity, hydration, and nourishment to the skin. It's a night cream, a day cream. It's extremely good for people that suffer from dry skin and aging skin. It's very natural around the eyes and helps a lot with people that suffer from dry eyes. And I'm doing a study right now with this eye cream, combining the use of the cream around the eye with teardrops, and it replaces the need for using other alternatives of medications that need to be used if somebody suffers from dry eyes. Years and years of studying what makes a face beautiful and what is the new definition of good result. What do we call a good result? It's a result that's pleasing, that's not plastic, that's not overdone, that's proportionate to a face. And I usually try to educate and guide my patient in that direction. So a patient that comes and has a European fluid facelift will have some kind of confidence that their look, it's going to be a natural look. They will look themselves, they will not have surprises, and they will actually be impressed in how natural they look. Sometimes I ask my patients to bring pictures from how they look years ago to how I could make them look with this procedure. And here we have a beautiful lady in her late 40s, let's say, very well maintained, a beautiful face. She tells me that she's concerned about these two lines and the marionettes. And I looked at her and I said, look, show me your frowns, lift up your eyebrows, and do this. So I immediately noticed that she needs to address these little lines and wrinkles on her face. I would recommend a new product for her face, which is called Velour. It's used for treating the nasolabial folds and the marionette lines. Sometimes I also use it for the lips. I would put the Velour in the nasolabial folds. I would put some in the perioral area, and I would use a little bit of Radiesse in her cheeks to just create a nicer, natural result of my treatment. Very good. So we clean. It's always good to use alcohol and maintain a sterile technique. This is the BLT numbing cream. I like to use that and leave it on the face for about a few minutes before I start the treatment. So this is not a painful procedure. So I usually start by doing the Botox treatment. When I'm planning a fluid facelift, that's the first one I do. And then I'm going to talk about the amount of Botox that you need for each part of the face. Many times I combine Radiesse with Voluma for even more enhancement of the mid-face. These are deep treatments. We have to go deep on the bone, on the periosteum, and that creates the mid-face lift, sometimes better than the surgical improvement. But it has to be diluted, so I dilute this with lidocaine. So what we do, we call live injections. So now we accomplish the consistency. We're going to start with the Botox. There are two muscles when we inject the 11 lines. Is the corrugator and the procerus muscle. The corrugator has this one, and the procerus is the one vertical. And unless you treat both, the 11 lines are still going to be present. Now, the lateral aspect of the eyebrow has to be higher than the middle. That creates a nice, desirable position of the eyebrow. So this is Velour for nasolabial fold and for marionette lines. It goes not as deep as Voluma, it goes more into the dermis. For her lips, I'm going to use Volbella. Volbella is injected into the vermilion border, which is the edge of the lip. and it creates that nice definition of a lip. This is a perfect lip result. Why? It has the shape of a diamond. The two pubis bows are well defined and discreet. The upper lip, it's 2/3 of the size of the lower lip. The upper lip has a point. It has the two lobes, and the edge of the lip, it's higher, and like the end of the lip, it's higher than the middle. So it's a nice, happy looking lip. The bottom lip has two lobes and the proper volume. And with that being said, I think she looks amazing. Let's see what gravity does to your face. We're also offering PRP. What's PRP? We're injecting plasma in the scalp, and also patient's own plasma in the scalp, and sometimes even different facial skin areas for skin rejuvenation and for hair growth. This is done by collecting someone's blood, centrifuging and separating the red cells from the plasma, and the plasma that's rich in growth factor stimulates regeneration of skin and hair production, new hair follicles. And this is one of the newest and best treatments for hair loss. In summary, the European Fluid Facelift is a great alternative to traditional surgery. It has less downtime. It's cost-wise, it's much less than traditional surgery. The results are natural, immediate, and if you want to look younger and discover your fountain of youth, think no more and visit us at Mediface Spa and my office. Our team is highly trained and skilled to address the signs of facial aging, and I'm sure you'll be happy to at least come for a free consultation and hear more about this wonderful procedure.